My case is Gnathostoma spinginium is a parasitic nematode that causes ganthostomosis in human. Orbital ganthostomosis is a rare parasitic infection usually acquired by the eating raw or uncooked invertebrates harboring larvae in their tissue. However, infection is also possible by direct penetration by the actively moving the flying and laying the egg. Superficial infestation are painful and irritating, but the impact of deep infection is more devastating if the infection or infected organ is brain, and the person affected may be the paralyzed or die. So this is actually case report, and I put for the e-poster, but it came for the study here. So this 65 years old female, labor by occupation, brought to the hospital by her son with complaint of foul smelling discharge from the left orbital tissue site. They also noticed that multiple small white yellow bomb-like structure crawling over the wound. Patient complained of severe itching and loss of vision from left eye for past 1 month. She was a known case of squamous cell carcinoma of left eye, upper lid, and was on chemotherapy and planned for the surgery, but due to the COVID-19 lockdown, she lost her follow-up to the hospital and landed up in this situation. So on general examination, the patient was conscious and oriented. Local examination best corrected visual acuity in the right eye was 612, and PL and PR was negative in the left eye. There was necrotized periorbital tissue with the rodent ulcer in the extensive freely moving maggots were observed throughout the left orbital area, and no globe structure was seen. Total destruction of the left orbital site. Mechanical removal of the maggots was done meticulously with the help of forceps after applying the turpentine oil. A total of around 100 maggots were removed. The maggots were preserved in 10% formalin and sent for the entomological evaluation to the Department of Microbiology. On examination of the bed mount, it showed that bullous head with the 4 row of hooklets. The anterior part of the worm is covered with the row of cuticular spine. Diagnosis of Gnathostoma spinginium was confirmed by the microscopic examination. Patient relatively explained was a life-threatening condition. If possible, maggots entered the brain parenchyma, and routine topical and systemic antibiotic along with the anti-inflammatory were administered. Regular dressing done, wound debridement and removal of the maggots done for next 3 days. Along with the routine blood investigation, CCT brain and orbit was advised. CCT brain right orbit was normal, whereas the left orbit was small and shrunken, distorted and dysmorphic, suggestive of phthisis bulbi. Patient was sent for the oncology department to restart the treatment, and the wound started healing with the granulation of the tissue. This is the CCT brain. This is with the finding showing the left globe is small and shrunken, distorted and dysmorphic. So this is the day 3, and this is the second week, and after 4 weeks, we can't save her vision, but we can save the eye with timely intervention. And my discussion is of the 12 known species with the genus Gnathostoma, only 4 species have been known to be infected in human, namely Gnathostoma nipicium, Gnathostoma hipicium, Gnathostoma dorsale, and Gnathostoma spinginium. The Gnathostoma spinginium is found in a wild and domestic cat and dog in Southeast Asia, China, Japan, and India. Among the various forms of visceral ganthostomosis, central nervous system infestation causes fatal eosinophilic myoencephalitis, whereas ocular involvement is rare. Till now, 14 intraocular ganthostomosis cases have been documented. Clinicians should be familiar with the disease, therefore a diagnosis is not missed and delay, avoiding potentially serious complication. In this case, we could not save her vision, but due to timely intervention, we save her life. Thank you. This is the life cycle.
Is there anything in the history which told you how the patient got this infestation? Mentioned that.
Ma'am, actually, the patient came in the mid of 2021. That time COVID was there and mucor was there. So first, she told they came because it was known case of carcinoma lid, and she was there in home because not getting treatment because of.
She have a pet cat, dog, eats fish,
No history. So maybe because of fly.
How she got this?
She was not taking that food, and she don't have pet cat and dog there, sir, ma'am. I did mention, but.
Treatment, what antibiotic and what was the duration of it?
7 days we kept here, and the Taximo only have started. IV antibiotic we have started because inflammation was severe.
Gnathostoma, you specifically mentioned that albendazole is
Uh,
given an anti-inflammatory
And
steroids are required.
yes, ma'am. That
This
time.
is a normal course of
Yes,
treatment,
yes,
isn't
ma'am.
it?
Yes, ma'am.
So that you must mention if you are giving what antibiotic, because that is
Oh.
how it helps. If
To-
somebody is looking at your poster
Okay.
or a paper,
Okay.
that what was the treatment, if they get a case, at least they know what the treatment you have given them, isn't it?
Okay. Thank you. Thank you.
And like when the patient presented to you,
Yes,
before that, how long was the history? Like first she had a carcinoma. Like,
Yes, ma'am.
that was, history was how long?
Around 2 years back, she had carcinoma. Chemotherapy was done already, IGMS only, but
Chemotherapy.
OPD was closed in COVID period, so she came with this problem.
So could you like link it like chemotherapy and she had radiotherapy also, no?
Chemo and radio, yes, ma'am. Before it was given, but not because of the this chemo radio related, because maybe neglected case in the COVID-19 time. She was not taking any treatment and proper dressing was not done, and slowly it's developed like that.
That could have led, immunosuppression could have led, so many factors, and of course infection, secondary infection can occur.
Immunocompromised.
Okay, how is the patient now? You followed him?
No, patient now expired actually because of complication 2 to 3 months back.
Oh.
That time she saved, everything was done. So this is 1 month follow-up only here. And
Okay.
almost 2 months back I have, she came with the severe systemic involvement also because of the tumor, and so
She expired then,
now
yeah.
she expired, ma'am.
Expired, okay.
To be very
So
frank.
that could have been related to the primary carcinoma or due to
Carcinoma, because of the carcinoma, not because of this problem she expired. And she got renal problem also, and diabetes she had, so
she had a
because of multiple involvement
She died.
she lost. We follow up for next 6 months, 6 to 7 months, and last 2 months back she came and her with a severe pedal edema and everything, and admitted in the emergency, but after then
otherwise she could not
patient lost.
survive.
Yes, sir. This is 1 month follow-up. That time we saved the patient, but
After 1 month she was okay, but then
6
over
to 7 months she was okay, but because of the lead carcinoma she died, and metabolism.